debate. In Glasgow city centre, Ms Ryan, there are around 500 people there or thereabouts injecting drugs on a regular basis. If you come to Glasgow, you probably won't see it, but for many of my constituents, this is a huge issue. Before I was first elected in 2007, the issue of discarded needles was pointed out by a resident, pointing me to a bin in a children's play park. I have an enduring horror, Ms Ryan, that eventually, sooner or later, a child will get pricked by a contaminated needle. It's a daily hazard for our council cleansing staff, and no one should have to live with that risk. The issue has never gone away in that time. It's simply moved around. And indeed, a constituent earlier on tonight, Andy Ray, told me he came back home to find two contaminated needles on his doorstep. As the member for Bristol West said, the problem is already there. It is on my office doorstep too. A constituent wrote to me over the weekend to say that in the 18 months that she's lived in her property, there have been countless times that I've seen people injecting drugs in the bin area, doorways and car park. They leave behind their needles, bloody wipes, spoons and bottles all over the area, strewn all over the ground, grass and hedges, as well as urine, vomit and blood on the ground. This is a nice, quiet residential area, home to people both young and old, families with children, students, people taking their dogs out. It's also in very close proximity to a children's play park directly across the road. And another constituent I spoke to on Monday told me of witnessing prostitution in bin shelters, of groups of people taking drugs under the stairs. I regularly walk around this part of my constituency, Ms Ryan, reporting needles as I find them. And after my surgery on Friday, amongst the usual places, I saw a young woman injecting herself behind a derelict building. There is no dignity for that woman, there's only desperation. This is the reality of life for intravenous drug users in Glasgow and the impact of their behaviour on residents. It is deeply damaging for everyone involved. Each of those people injecting drugs is someone's child, is loved by somebody, and we owe it to them to find a better way. There has been no means of dealing with this situation, and it's imperative that we do something different. Glasgow Health and Social Care Partnership concluded that the only way to deal with public injecting is to provide a safe, managed space for people to inject. In this way, we can also respond to the concerns of residents and businesses and meet the needs of a very vulnerable and marginalised population who do not engage in services. The Health and Social Care Partnership have a clear, well-thought-through proposal for a drug consumption room, and I would commend the Minister, if she has not already read it to take note of the report, Taking Away the Chaos. Look at the evidence that they've gathered. I would like to pay particular tribute to Sakit Priyadashi for his work on this and to the commitment of Suzanne Miller from the Glasgow City Council and folk like Kirsten Hosper from the Scottish Drugs Forum for their advocacy of this important project. The Health and Social Care Partnership have done significant work to establish needs, protocols on how it would work, to listen to a range of health professionals as well as those who use drugs, and to find the means of funding it. It would be more than just a room, but a service, a bespoke service staffed by health professionals with a wraparound service to help people reduce their drug use and stabilise their lives. There would be an opportunity for those not currently accessing health services to do so, and for people to get assistance to rebuild their lives. The proposed Glasgow model is all about engaging with drug users to promote treatment, rehabilitation and social integration, as well as providing harm reduction services. The Minister must recognise, she must, that there is a cost in not taking action, in doing what we've already done. And this cost manifests itself in treating the latest HIV Hep C outbreak in Glasgow. It comes at the cost of emergency admissions to hospital. And the report mentions that over the last 5 years, there's been an average of 232 ambulance attendances in the city at suspected overdose just in Glasgow. There is a cost, as the member for Brighton Kempton mentioned, in doing this, and the Australian example will show how that cost can be saved. There is a risk to council staff, to housing association staff in clearing up needles, sometimes in their hundreds on sites, and as soon as they're cleared, those needles come back again and again and again. There's also the human cost, Ms Ryan. The cost of lives written off and wasted. And the member for Glasgow North East mentioned some of the figures. 867 drug deaths in Scotland in 2016 alone. We can't put a price on that, Ms Ryan. But for every family lost to addiction, every person lost to addiction, a family is bereft. Anyone's child, families for safer drug control support, drug consumption rooms. And I've listened carefully myself to people who have lost family members, and they were clear that drug consumption rooms would be a positive intervention, that at the very least their loved one would not risk dying alone in a filthy lane. Instead, they would be in a place of safety, supervised by medical professionals, and as has been mentioned, there's not been one single death in a drug consumption room anywhere. The difficulty we have in Glasgow is that this project cannot go ahead without the permission of the UK Government, unlike in Ireland, where the Anna Liffey project and then Minister, now Senator Reardon, made a change to the law to allow it. The Lord Advocate can't pursue this, and an exemption from the Home Office has been refused. I have a letter signed cross-party from the majority of MPs in Scotland, cross-party, Ms Ryan, requesting leave for this pilot to go ahead. If it doesn't work, Fine, but at least try. The status quo is not acceptable. I invite the Minister to come to Glasgow, to come to my constituency and see how people are living. See if she would like to put up with my constituents put up with every single day. See if she would find it acceptable for somebody she cared about to drop their trousers and inject heroin in their groin in a manky back court, surrounded by excrement and contaminated needles. I'd like to leave with a quote from the report from someone in recovery. The person says, "You need to think about it differently. That's where I think safe injecting routes and injecting heroin is. You take away the chaos, then you have a chance to work on the attitude."